Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to talk about silicone injections. And I'm actually using silicone as an umbrella term for a bunch of off-label, strange injections that people might seek out. Now, the first question is, why do people do this? So people will do these types of silicone injections to plump up any area of the body. That can be the lips, the cheeks, the butt, breasts, anything, anywhere you can imagine it, it's being done. Silicone is kind of, like I said, an umbrella term because oftentimes it is mixed in with other substances that might include things like tire sealant, cement, oils, weird things like that. No one really knows what's going into these injections, okay? So this is why it's extremely risky to do. The FDA currently does not approve and actually warns against the use of any kind of injectable silicone products. Now, note that this is different from silicone implants, but any kind of liquid injectable silicone is currently warned against and is not approved by the FDA at all. And that's because of the safety profile. It is extremely risky in that this unusual concoction of substances that you're getting injected can cause inflammation or increased reactivity of the surrounding tissues. This can then lead to a lot of scar tissue, which can lead to strange lumps and bumps. It can actually kill some of the surrounding tissue, so you get skin necrosis and death. The only way silicone injections can be removed, unfortunately, is usually a very large surgery. And that's because you need to remove the entirety of the silicone in order to get the actual result. This is because silicone is so reactive that, as my old mentor, Dr. Nassif, used to say, it's kind of like poking a sleeping dragon. And if you only get parts of it, then the rest of the silicone can react and explode and cause all kinds of chaos throughout the rest of the body. So you need to remove it all, which means you're usually taking on a much bigger surgery than anyone is hoping to do, including the surgeon. And you can see how this can impact very sensitive areas such as, for example, if you had injections in your face, this can affect your ability to talk, eat, make any kind of facial expressions, not to mention the crazy amounts of scarring. If we're talking about injections in your butt, this can affect your ability to use the bathroom, to walk, to get up and move. So this is why it's extremely dangerous, because the treatment for it, unfortunately, is quite risky in and of itself. So if you happen to be lucky enough that you didn't get any complications in the beginning, pray that you never get one, but that's the problem with silicone injections, is they are permanent, so you never know when they might react to something. Unfortunately, the reason I'm bringing this up is because we have had a lot of inquiries lately about people who have had silicone injections and now want something to do for them. And it's very, very, very difficult to treat. So the best thing to do is just not get it done in the first place. They can sound very tempting because oftentimes you get to go to a place where you might pay only like $15 or $20 for these injections, which is much lower than if you went to a real medical grade practice that injects medical grade products. But the reason for that is it is extremely dangerous and risky, and do not recommend it. Do not save your money by doing something like this. It's much, much safer to just get it done right the first time. So, in conclusion, that's Dr. Lexie Wang on Face the Facts, and stay tuned for another lesson next time.